Everything about what this company does is grounded in evidence-based practices. Applied behavior analysis is no different. For many people who don't know, ABA is the #1 recommended treatment intervention for individuals with autism by the CDC. But more importantly, ABA is every day. It is the science of learning.
A major component of our present system is the incorporation and integration of applied behavioral analysis, or ABA. For myself, I had a unique experience over the years to understand the utility of ABA in analyzing not just people's behaviors, but also incorporating it into my treatment decisions. Before creation of NeurAbilities, I had experience in neurodevelopmental disability settings and some very intensive neurobehavioral stabilization units where myself, as the medical side, was working side by side with various types of ABA therapists and board-certified behavioral analysts. And I could see from the data collection whether or not my treatment interventions were successful or not. And that was quite eye-opening. Usually in my field, people were providing medications for behavioral issues and just getting subjective information, asking people, are you doing better or not? And if they weren't, there was a tendency to increase medication doses or expand to multiple medications, which of course caused a lot of side effects and other issues. But with ABA, I was able to see quantitatively whether an intervention was either reducing the behavior or not. And that can then tell me as a clinician whether I should continue with a medication approach or maybe change course. But also, it also provided insight into behaviors to see were they biologically driven or were there some other explanation for it? Was there a more functional aspect to it, for attention or trying to access something that they wanted or a communication problem? And I can see that behaviors can be solved not just through a medication approach, but often without medication, just through a behavioral management approach. So that component, when I set up NeurAbilities and our focus being on the population that often includes individuals with autism and other similar issues and many behavioral problems, that ABA was going to be an important component of what we had, and we integrated that as a crucial division of our overall approach.
I think that NeurAbilities is different because we truly care. We really care from start to finish when we, have our initial intake conversation with the family to making sure that we get the right staff on the case. And we really have, I think, a strong commitment to every single family that we serve, which has been truly different from not only a medical perspective, but also a behavioral perspective, which I think it's different and it's unique, and I love it.
We have tens of professionals in each clinic willing to supervise you, help you if you have any questions. You have the opportunity to meet multiple BCBAs with multiple levels of experience. Doctoral level BCBAs that can help you, that have been in the field for a very long time and have a wealth of information that you can pull from. So walking in the door, you basically get the university level experience and access that you might not otherwise find elsewhere.
So day one, I like to talk to my staff when they're hired about what their professional goals and career goals are. Weekly, we meet to discuss that, how the progress is that they're going towards that, and having my mentors kind of help me get towards my goals. I feel like everything we do and everything we talk about with our staff revolves around professional development and really trying to develop the staff, whether it's a behavioral health technician and they're new to the field, so making sure that we can kind of talk to them of like, what is your long-term career goal? And also the staff that might be in an operations position where they say, I want to be a CEO one day. So just kind of tailoring it to the individual and making sure that we can come up with goals and try and meet them.
However, the NeurAbility provides those collaboration with the other department, other professionals, especially when we have some clients have a medical issue, we can always consult with our medical professional. This is completely different from other model as a consultant working as a behavior analyst. At the NeurAbility, we can collaborate and we can bounce off each other the ideas and get better treatment for the individual.
Just the compassion. Everybody here loves what they do. They love the kids, but there's also a passion for high quality services. I mean, we do what we do because we love it, and we want other people to love it and do it correctly. So, high quality is very important to all of us here.
Communication is very big for me, so that's something I'm very passionate about, and developing people to be better consultants so that they can then deliver that and make sure that they're setting up their clients appropriately and making sure their families, we are advocates for our clients and for our families. This is the first time I've had actually the opportunity to be in a clinic with other kids and to have multiple other consultants. We're typically, or in the past I should say, we were in the field. And it can be certainly very isolating. If you're just on your own, sure you have supervision, but you don't have people. In the field, you always need a second pair of eyes. Sometimes when you're in it too long, you just need someone else to come in and say, "Oh, you know what? Well, I'm seeing this from this perspective." So this clinic provides us this really unique opportunity to be able to jump in and collaborate with one another. I've often had people come into my sessions, I'm jumping into other people's sessions. It also really enhances the culture of feedback that I think our fields we're very big on and we promote, obviously. So I think that's probably the most reinforcing thing to me.
I think the ability to write comprehensive plans is something that I came in. So I've had years of experience with that, but coming here, they really do bump the level up. So being able to write a treatment plan, being able to really make that data pop and be visible to not just you as a behavior analyst or the insurance company, it's also about bringing it to the parents. How do you make this information both technically and scientifically, adequate, but also able to be explained. Tying in different professionals also into that plan as well. So can you explain a behavior plan or your goals or your treatment methods to a doctor, to a nurse, to a psychologist, to a pediatrician? Those skills really have been built up and flourished here for me. So really expanded what I already had.
At NeurAbilities, we are looking for clinicians who want to be lifelong learners, who want to learn from other aspects of treatment and also other aspects of the individuals that we work with. We want people who are motivated. I can teach anything else. What I can't teach is the desire to make a difference and to make a change in the world. I do believe that we are saving the world, at least the little piece of the world that we have. I do believe that every child that we work with is its own unique opportunity to make a difference. If we help one child, we are a pebble in a lake and the ripple is amazing.